Okay, we're continuing with stress in human health. This is part 4. So here's the anatomy of a synapse in the brain. A synapse is a connection between two brain cells, two neurons. So this is the neuron cell body where it has its nucleus, for example. These are the dendrites that receive incoming information. Dendrite means like dendral, like a tree, the recipient synaptic components. Then this is the axon right here where you send an electronic message from the cell body down to the axon terminal. And then once this action potential wave of depolarization reaches the axon terminal, it'll cause opening of the voltage-gated calcium channels. It'll allow calcium to come in to the axon terminal. The calcium rise will affect these neurotransmitter vesicles, NT for neurotransmitter. They will travel to the synaptic cleft, merge with the plasma membrane of the presynaptic neuron, release the neurotransmitter into this cleft. The neurotransmitter diffuses across the synapse, binds to a receptor on the postsynaptic neuron, and causes an effect. It activates it, okay? In particular, glutamate. The relevance being that cortisol will also open up these voltage-gated calcium channels, and it'll cause increased cytoplasmic calcium. So the important point is it causes increased cytoplasmic calcium. So it'll cause a release of neurotransmitter, in particular glutamate, the excitatory neurotransmitter. That's the point of showing you that stress will increase glutamate transmission across the synapse. That's what you need to know. Okay, so here's a little more detailed picture of the synapse. So it's not exactly VGCC, but the point is still cortisol binds to the axon terminal and causes increased release of neurotransmitter. All right, so the neurotransmitter goes across the cleft, activates the postsynaptic neuron. You need to know that. Okay. So it has a stimulatory effect. Now there's something called psychological immune memory, and this isn't completely worked out, but it's a little bit interesting as an idea to how you can get a ramped up response to something. So basically, this is your microglia. These are your microglia. These little cells here are normal microglia. When they're resting, they've got all these long, big branches coming out of them, and the central fluid-filled part's real small, okay? This purple line is normal stress baseline. All right, so let's say you're going along fine. The microglia are part of the immune system. They're like macrophages in the brain, residential macrophages, sentinel macrophages, guard macrophages, whatever you want to call them. They're like security guards. They sit around waiting for a problem. Okay, so let's say you have some major psychological stress. Your spouse wants to divorce you, your boyfriend, girlfriend dumps you, you get in a car crash, something major happens, okay? That stress response, if it's big enough, it'll activate the microglia all the way. They'll go from being a resting, M0 macrophage to being an M1 fully activated. They might just become partially activated. And at this point now, they're sensitized. And if you have another similar stress, okay, like your boyfriend, girlfriend said they're maybe going to dump you, but they didn't really dump you and it freaked you out and you're all stressed out, and then they do something implying they are the next day, you might overreact. And the overreaction means like the microglia to start releasing its toxic inflammatory chemicals like interleukin 1 beta, for example. Okay? So that'd be an overresponse. So the idea of a psychological immune memory was memory of a previous major stressor followed by a minor stressor, but it's of a similar type, but now you're sensitized to that problem, can make you overreact, okay? So let's say a woman, husband teases her that she's maybe a little fat, but didn't outright say it. That was a major stressor for her. The next day he makes another fat joke, and then she overreacts, okay? That's kind of what this is about, all right? And so this is still being worked out in the psychology literature, but I thought it was kind of interesting, a little bit amusing. And there certainly is truth that once bitten, twice shy. We have a tendency to overreact. If somebody screwed us over in a type situation and we forgave them, and now they seem to be screwing us over again in that situation, we're sensitive that they're going to do the same thing again that major stressed us out before. So that's the concept of psychological immune memory. But it's also the concept that excessive psychological stress can have a component of neuroinflammation related to it. Okay? So there's a lot of things that can cause neuroinflammation, but I'm just letting you know excessive psychological stress can have a bit of a neuroinflammatory reaction related to it. Okay, so the important lesson is try to understand what the heck is going on as best you can without overreacting, but you need to be ready to react in case it's for real, so it's not that simple. M2 microglia, so the M1s are the inflammatory chemical releasing activated macrophages. M2 are sometimes called alternatively activated or neuroprotective macrophages, and they can be important, for nerve repair, regeneration, making anti-inflammatory cytokines. Okay, so the next thing is, what about the cortisol effect in the hippocampus? So the hippocampus is the memory center for declarative memory, things that you can say. On, January the 7th, I was, climbing in the Alps, skiing in the Alps, okay? That's a declarative specific memory, an autobiographical memory, okay, of a fact versus procedural memories like, I learned how to ride a bike. I can't really tell you what you do. I just get on and I start riding. Okay, so anyways, excessive cortisol, day after day of chronic psychological stress. Let's say a patient who had a severe, life trauma, and they keep re-experiencing that event in their mind's eye. They can't distract themselves away from it, get busy with something else. That over time can, like roasting it on a neuron on a spit, that can lead to hippocampal atrophy and destroying neurons. Short term, that can be, if it's a short term event, that can be fixed. But if it's a long term event, you're going to damage your hippocampus and it's going to shrink and you become stupider. Okay, so chronic severe psychological stress and PTSD can make a person, decrease their cognitive function. Cortisol has a more prolonged effect than do the catecholamines. Cushing syndrome is when you have elevated cortisol. It can be either from the periphery causing that, or it could be a central problem like a pituitary tumor. But either way, those are other things that can lead to hippocampal atrophy. But the big point of all this was chronic severe stress can lead to hippocampal atrophy and decreased ability to learn and decreased cognitive function. So that's why, especially you think about some poor kid that's all stressed out a prolonged amount of time. They're going to have a hard time learning in school. Okay, what is iatrogenic hypercortisolism? Well, that can be, from taking cortisol medication. Sometimes they're given as immune suppressants. Sometimes they're given to prevent edema, brain swelling with intracranial metastatic disease, for example. Okay, we talked about catecholamines, how they increase the heart rate, they cause vasoconstriction, they increase blood glucose, they cause insulin resistance. Okay, so they worsen diabetes. So being stressed out worsens diabetes. Okay, what is the effect of stress on the blood? Some of this we talked about. They increase the clotting proteins, fibrinogen, factor VIII, von Willebrand factor, activate platelets. So they make you more prone to clotting. So they increase your risk of a heart attack, okay? So if your old man looks stressed out, don't bug him for no reason. Let him recover from his stress first. What is the effect on kidneys? Well, anything that causes hypertension is going to cause more atherosclerosis of the kidneys, so that's detrimental. It's going to cause hyperlipidemia, more atherosclerosis in the kidneys, so that's detrimental. It's going to predispose to diabetes. Diabetes is toxic to the kidney, like diabetic nephropathy, so that's detrimental. So chronic severe stress is bad for the kidneys, can contribute to worsening kidney failure. A lot of old people got chronic kidney disease, CKD. Okay, cortisol causes osteoporosis because it suppresses osteoblast, growth bone function, and you can get increased urinary calcium over time. That can increase your risk of, calciuria, calcium in the urine. That over time can precipitate in the kidney tubules, and that can lead to decreased kidney function, eventually kidney stones, and even obstructive kidney uropathy due to stones, and that can be very painful. All the time when you look at a CAT scan of the abdomen, it's very often you see all these little calcifications in the tubules. Some patients, of course, much worse than others, but there's even something called medullary sponge kidney where it's quite excessive. But either way, excessive calcium going into your kidneys from chronic severe stress is bad for your kidneys. Okay. You get more calciuria if you're drinking caffeine or you're sleep deprived, because they do the same thing as stress, elevate cortisol and catecholamines, okay? All right. Let's see, sedentary lifestyle also causes breakdown of the bone because you're not mineralizing them for bone growth. There's something called Wolff's Law. The more you use the bone, the more it maintains its mineralization, the ossification of the bone, so to speak, which strengthens it, okay? So you got to keep moving to maintain that. What's the effect of stress on the gut? We talked about that. Splanchnic shutdown. You don't need the gut to digest while you're trying to survive from being chased by a tiger. You shut down the blood to the gut for a little while, no big deal. Chronically, you make it ischemic, severely deprived of oxygen such that it'll break down. You get loss of your tight junctions. You'll get leaky gut. You get bacterial endotoxins in your blood. When you got leaky gut, you're probably short on butyrate for your brain, so you get leaky blood-brain barrier, bacterial endotoxins, LPS, LTA. Get some access to the periphery of the brain. Those will activate microglia. The microglia releases toxic chemicals in response, like interleukin-1 beta. That causes inflammation of the adjacent brain, collateral damage, so to speak. The microglia releases those toxins because its pattern recognition receptors have bound to the bacterial endotoxin, the LPS, the LTA, and it thinks it's being invaded by bacteria. So it releases those inflammatory chemicals to sterilize the area. But it's really sort of a fake out because it's just the endotoxin, but the microglia doesn't know that, and that toxic inflammatory chemicals that the microglia release will damage the local brain cells. That's collateral damage. Okay. We talked about the immune system being shut down, so it can't fight infection or cancer as well. I know another weird little thing is catecholamines can function as siderophores. Sidero means iron, forta, transport, so it can transport iron even into bacteria sitting around in the blood, so it'll actually increase the risk of an infection in the blood. Not good. Okay. Elevated chronic high cortisol suppressing the immune system can actually cause reactivation of viruses like herpes viruses. People can have a breakout down below if they got genital type of herpes. It's a different type of herpes that causes cold sores, but a cold sore is more likely to become activated when somebody's chronically stressed. When somebody's chronically stressed, they can get reactivation of other infections in the body like a blepharitis of the eyelid. Okay. What about stress and cancer risk? We talked about that. There's increased cancer risk. We talked about all the mechanisms of increased cancer risk. All right, and I think we'll stop right there for now. That's part 4 of stress and human health. Hope you find it helpful. We're going to do part 5 in just a little bit.